if you've been trying to conceive, you're having regular intercourse with your husband, that is every 2 to 3 days, and conception is still not happening, then I'm sure you're already wondering why. Now, one of the questions we need to answer as to why this is happening is, are you actually ovulating? Okay, and I'm not asking if you get your monthly bleed, okay, because it's possible to get your monthly bleed and not having had an ovulation. It's very possible. So one of the common mistakes women make when you ask them this question is, oh, I ovulate. And when you say, how do you know? They say, oh, my app tells me I ovulate. No, your app cannot tell you that you ovulate. Your app only makes educated guesses based on the information that you've been imputing in it. Okay, it can only guess that you ovulated at this time, but the only real way to know that you're ovulating per cycle is getting real data from your body. Okay, so I'm going to share 6 ways to help you track ovulation. You don't need to use all 6 of them, but I recommend using a combination of methods to help you actually predict and confirm that ovulation is happening. Now, I have the methods grouped into two: the predictory methods and the confirmatory method. The predictory methods will help you time intercourse, know when to do your baby dance and all of that. While the confirmatory methods will tell you that ovulation actually happened. Now let's go to predictive method. Number one, it's the simple lower abdominal pain that you can have either on your right hand side or on the left hand side of your, either on the right or the left side of your lower abdomen, and it's like a slight cramp. Some women have it more serious than a slight cramp, actually, where they need to actually take medication to relieve them of the pain. But some people don't actually notice it. You need to pay attention to your body to be able to notice it. Well, some people don't even get it at all. But if you've never noticed it, I want you to start paying attention to your body from when your period ends to the next period, and see if there is any day in that time period where you feel that slight cramp. Okay, so look out for it, and that would let you know that ovulation is just around the corner, because that cramp comes when an egg is just being released. So that's a good way to check. But if you don't get it, it's fine. There are other methods to know whether you are ovulating and when. Okay, so prediction method number 2 is the cervical mucus. That's the egg white stretchy discharge that comes from your lady part. Okay, so when ovulation is just around the corner, your body produces this slippery discharge to give the sperms an easy passage. Before now, the discharge you have is something that would make it difficult for the sperms to swim up to your womb. But this egg white consistency or egg white texture of vaginal discharge helps the sperms to swim up to where they can meet with the egg for pregnancy to happen. So when you start seeing that stretchy discharge, then ovulation is just around the corner. Now, if you feel like you don't have it, it's possible that you get it, but it's not so much as it's not so much for you to notice in your panties. So what you can do is, when you go to pee, try to wipe with a tissue before you pee, because it's possible for your urine to dilute it and make it not as stretchy, and then you obviously won't even know that it's there. So do that, and then you would know whether or not you get it. Okay, so prediction method number 3 is the ovulation prediction kit. It's just like a pregnancy test strip. I'll just get one here. Anyways, before I talk about that strip, I'll just do a brief science, okay, to talk about how this works. So there's a hormone called, excuse me, there's a hormone called the luteinizing hormone. Its job is to trigger ovulation in your body, and how it does that is by spiking its level. So let's say it was around random. This is just random. Let's say it was around level 10 in your blood, and then when ovulation is just around the corner, it spikes up to random figure again 100. So that spike, that surge that you get, is what triggers ovulation. Okay, so what this strip does is just like a pregnancy test strip. What this strip does is that it detects that that spike has happened, that surge has happened, that luteinizing hormone in your bloodstream has actually surged. Okay, so you use it like a pregnancy test strip. You just dip it in urine and then you check. Now, a good thing to notice for the pregnancy test, what you're looking for is just 2 lines. faint or not. But for this prediction kit, what you want to see is that the test line is thicker, at least as thick or thicker than the control line. When you see that thickness, that is a positive, and then just know that your ovulation would most likely happen within the next 24 to 48 hours. Now, it's important that when you're using this strip, you're testing not with your first urine like you would for a pregnancy test, but you test between 10 a.m. in the morning and maybe 8 p.m. in the evening, and whatever time of the day you choose, you have to stick to that time until you're done with your test period. Okay. Now, for some ladies, some of my ladies that have PMOS, formerly known as PCOS, I would not really recommend using an OPK, an ovulation test strip, because usually for some ladies that have PCOS, PMOS, what happens is that the LH levels in your blood are usually just high on a steady basis. So even when you check, whenever you check, you get like a positive, but it's not really positive because it's already high, so there is no surge happening. So what you're getting is just a false positive. Okay, so if you have any questions, if this sounds confusing, please leave me a comment and I'll be happy to answer your questions and clarify. And then if you're enjoying this video, please don't forget to leave a like so that somebody else who needs it can find it. Okay, now it's possible for your body to have a cycle where your body attempted to have an ovulation, gives you clues, you see the mucus, you feel the cramp, but ovulation failed. So it's possible to have a failed ovulation, and this is why it's important for you to be able to confirm that ovulation actually did happen. And that will bring me to the confirmatory methods. Okay, now just a brief science before we go into the confirmatory methods. After an egg is released, after you ovulate, what happens is your body leaves something that I'll just, for the purpose of this video, call a shell, like the shell of the egg. It leaves it behind in your ovary. The egg goes on its way to find a sperm, and that shell is left behind in your ovary. That shell is what we call a corpus luteum. Okay, usually that shell begins to release the progesterone hormone. Now, the confirmatory methods are just looking for after signs of ovulation. They're looking for signs that ovulation actually happened. Now, the first method, which is, to be honest, my favorite method because it is something you do yourself, it is inexpensive, is measuring your body temperature every morning. Every morning when you wake up, before you do anything at all, before you get out of bed, if possible, get your temperature checked. But if you can't do it manually, there are devices that you can wear, wearable devices that track your temperature and gives you like what's happening. Now, how this helps you to track ovulation is when that progesterone hormone rises. Remember, I said the shell begins to produce progesterone. As the progesterone levels in your blood begins to go up to confirm that ovulation has happened, while you're tracking your temperature, you'll be finding out that you're having an increased temperature. And so if you look at your chart at the second half of your cycle, you would notice, if you have ovulated, you would notice that your temperature is higher than it was before the ovulation happened. So that gives you that lets you know that you've actually ovulated. Okay, so even if you got your prediction method wrong, like you thought, oh, you were ovulating, and then when you thought you were ovulating on this day due to when you saw your cervical mucus, and then you track your body temperature and find out that, oh, you timed the intercourse wrong, you didn't get the prediction right, it is still good information because you can take that information and pinpoint, or at least give a good guess as to when you're ovulating by your next cycle, especially if you have irregular period. The downside to this method is for people that work night shift, I would say it is usually, I don't know, you've already worked all night, your temperature is high, so your temperature is already affected by all the activities that you've been involved in. So it is possible that it is almost impossible to get that steady, accurate temperature of your body at rest. Okay. Now, another downside is that it's possible if you're unwell and you have a fever, that fever will basically mask any temperature rise that progesterone is given in your body. So you can't even tell where this fever is coming from. Is it from being unwell, or is it from um or is your body temperature high due to progesterone? So you can't really tell. But apart from that, I think it's a good method. Now, prediction method number two, sorry, confirmatory method number two is having your blood levels checked for progesterone. Remember what I said? After ovulation, the shell left behind begins to release progesterone. Now, if you've done any form of hormonal profile test, they've most likely asked you to come back on day 21. Now, for some people, this is actually not the right time for them to do that test, because coming back on day 21 is assuming that this person ovulated on day 14, and we know that not every lady ovulates on day 14. In fact, I had a lady I worked with, she had come to me believing that she doesn't ovulate, and I was like, how do you know? She said she did her whatever on the 21, and I said, okay, let's properly track. We took some time and we started tracking cycle after cycle, and we found that this lady ovulates on her day 21. Now imagine that on day 21, when her ovulation is happening, that is when that test was done. By this time, the progesterone levels were still low. So with that, she was able to time intercourse correctly, and then she got pregnant. She's currently pregnant. The third point when it comes to tracking if ovulation actually happened is getting an ultrasound, just to look into your ovary and see if that corpus luteum, that follicle is in your ovary, that shell is in your ovary, so it confirms that ovulation actually happened. And you see why tracking your temperature is like my best, because if you combine that with your cervical mucus um and your lower abdominal pain, you may not need so. And if you want and you don't have PMOS, you can use the prediction kit, the ovulation prediction kit, and it will give you what you need to know as to when to time intercourse and to confirm that intercourse actually happened. Now, some people may be wondering, why do they need to confirm that ovulation has happened? If, I mean, you can just do your intercourse every 2 to 3 days, and if ovulation happens on any day, you will most likely meet on the day that ovulation is happening. Now, not everybody is able to time not everybody is able to have that regular intercourse with their partners because of work or other things happening in their lives. And for some other people, it's because you've been trying and it's not happening. So you really want to know where the issue is so that you know what to address. Now, the first thing you need to know is, are you ovulating? If you check and you're ovulating, good for you. It tells you that this is not where to point your searchlight. You need to direct your attention somewhere else. But if you check and you track and you're seeing that ovulation is not happening, at least lets you know where the issue is, and it helps you address the problem. I hope this has been clear enough, but if not, I'm happy to answer any questions that you may have. Please leave whatever comments or questions you have in the comment section, and I will attend to them. Please don't forget to like this video, just so that somebody else, a woman that is trying to conceive and wondering, can find this video and watch it. Okay, and consider subscribing as well. Okay, thank you very much for being here.